Janice Simpson here with Janice Simpson 777 Training Programs, talking to you today about treatment plan adjustment versus a treatment plan upgrade. So your patients come in, they get treatment, and then on their subsequent visits, you're going to build a relationship with them that is fantastic. So they're not happy if something is not meeting their expectations. They're going to communicate with you that they just don't feel like they're making any progress. Or they may say, I just don't like that treatment altogether. Now, when it comes to injectables, it's important that you tell a patient that you're going to give a specific dosage today, and while, especially if it's the first time you're seeing somebody, you're mostly treating symmetrical, but let's say they get a little bit of a brow arch on one side and not the other. I know that a lot of practices like to do touch-ups. I cannot advise against that enough. There's just not enough of a profit margin on the injectables to do touch-ups for free. The way that you stop doing that is you tell a patient at the time you're doing the injectable that you have a lot of muscles in your face and they are working in symmetry, but we are all imperfectly perfect. So they may have more muscle mass on one side. There's any number of reasons why they may need a little more Botox to bring down a brow, bring up a brow, or just bring symmetry to the work. If you tell them at the time that you do the injections that you want them to come back because you want it to be perfect, and don't be afraid to use that word. I know people have gotten away from using perfect and perfection and all of that. It is a word that can be used figuratively as well. Perfect being getting the best result possible for that patient. So don't be afraid to say, I want my results to be perfect. Because, you know, shoot for the moon, get some stars. It's okay to say that. So tell the patient you want to get perfect results for them, to make sure they come in for their follow-up appointment, or if you want to do something virtually, that's perfectly fine as well. Perfect. Just keep in mind they may have to come in. Often a patient will get a asymmetrical result, even ever so slightly, where the tail of the brow may move a little bit more on one side than the other. Then they'll just leave it that way because they don't know that that can be fixed. So education is vital, but getting back to my point, being upgrade versus an adjustment, okay, tell them they may need to upgrade their treatment plan a little bit to a higher dosage. So whenever they come back in 2 weeks, if they need 2 units, 4 units, 6 units, whatever it is they need, they're expecting that on that particular appointment, you're giving them the best bang for their buck, but they understand that when they come back, they may have to have a few more units and they may have to pay. That's an upgrade. So the biggest difference, or the difference, the way you differentiate between a treatment plan adjustment is an adjustment is it when you make an even swap. So let's say a low to no consumable for another low to no consumable. And when it is an upgrade, that involves a cost to the practice. So let's say somebody is getting infrared skin tightening treatment of some sort, and they say, you know what, I don't want to do that. I have decided I just want to do the fillers. So you would determine what services have been rendered, subtract that from their treatment package, and then determine what the difference is between the treatments that they paid for and the injectable. At any rate, there's never should be a cost. With proper education and good standard operating procedures, there should never be additional cost to the practice for changing a treatment plan. If you're changing to do an upgrade, that means there's a cost to the practice that should be passed on to the patient, and they should not be surprised about it, because before they purchase in the first place, they understand how these fees can occur. So again, proper education with the patient, recognize the difference between an adjustment and an upgrade, and make sure you stick to that policy for every single patient, because they talk to themselves outside of your office and you want consistency, and so it's super important that you follow your own procedures. Have a good day.